Greetings, everyone. It's great to be here on another preview of the joint Global Hybrid Summit. And I am so pleased to have with us today Dr. Deepak Kalra, already in studio. Hello, Deepak. Again,
Hello, Paul.
good afternoon or good morning, according to where you are, but probably good afternoon.
Yes, it's afternoon for me.
It's great to have you here in the studio as well with Jens de Klerk joining us from Ghent. Hello, Jens. Good to have you
Hello.
on the.
Good afternoon, Paul.
It's great to have you here again with us, Jens. This is a preview of the joint Global Hybrid Summit that is going to be this year a combination with the annual conference of the IHD. And it's great to have here the organizing team, and Dr. Deepak Kalra, the president of the IHD, is going to give us a little bit of a preview on the upcoming event. I have also here recorded from last week, and it was also already broadcasted live a few days ago, a statement from the European Health Data Space that we're going to use in order to close the session today. But without further ado, Deepak, perhaps you to give us a broad lines of what we want to accomplish this time with this upcoming event in Ghent. What are our objectives?
Well, thank you very much, Paul. First of all, I think I should say that the focus of our whole institute and of this conference is about health data. How can health data deliver the best value to everybody who creates it, who uses it, who shares it, and who develops innovations from it? We deliberately like stakeholders to come together in order to learn from each other. So many of the issues and challenges that health data now needs to address are multi-stakeholder. So we really value the fact that in our audience, there will be patients, there will be health professionals, healthcare provider organizations, research projects in various areas of digital health and health data. There will be industry, the pharma industry, the med tech sector, the big tech sector, and there will be decision makers and policy makers, such as the European Commission, such as FPA, such as the WHO. And these are just examples of many stakeholders who come together. And what we like to do is to organize a conference around some of the hot topics that are either facing data or are facing health systems, so that we can really help bring the stakeholders together around those. As you would expect, one of the biggest topics at the moment is the European health data space, this multi-billion euro program to really help spearhead faster, more complete, more pervasive access by European citizens to a patient summary and other key health data wherever they are in Europe. So whoever sees them for whatever reason, emergency or planned care, can have enough information to be a safe healthcare professional looking after that patient, and what happens can go back to the patient's home practitioner so the patient has safe continuity of care. And then, of course, to spearhead innovation and research, public health intelligence and health system planning, the ability to share with a lot of safeguards data sets that have been accumulated within member states or across member states for European-wide reuse and European-wide learning. I mean, there are many other topics, I could go into those, but maybe that's the headline for the moment, really, bringing people together to really look at the opportunities and the excitement that is really on our doorstep now.
Fantastic. Amazing. And I see, Jens, that you are responsible for the program. And this year, we have an amazing collection of keynote speakers from all across the different health data specialties. and also some decision makers and politicians, as you have the Deputy Prime Minister of Belgium attending, right, Jens? Can you expand on that, please?
Yeah, sure. Thank you, Paul. So we have several keynotes coming from groups, and very interesting people who are going to give talks about their experience and their what they are doing considering health data and reusing health data. Today we have some very nice keynotes. For example, we have Reich, who is coming to talk about European health data. We also have Emmanuel Bakri to give a talk, a keynote on the use case, what they are.
Oh, I think we are missing
in France on the hub. And also, sorry?
Yeah, I think we are kind of missing you on the line,
come again,
Jens.
Paul? Sorry, yeah,
yes,
the internet connection is quite bad for the moment. So yeah, so maybe I can start over again. Sorry. So we have some interesting keynotes. So on day one, we will start the day with some keynotes coming from the Belgian and Flemish government, people in the healthcare sector, also from the city of Ghent, who is going to welcome. And then we will have some keynotes talking about the health data space and so on. So for example, we have André Reich coming to give a talk on the European health data space. We have Emmanuel Bakri, who is going to give a talk on the use case, the health data hub in France, what they are doing there. But also people coming from FPA, so very interesting and very valuable, high-ended keynote speakers. And on day two, we have also coming from different stakeholder groups. We have Steve McFeely coming from the WHO, but most we have a lot of people, keynotes to address the point of view of importance, patient empowerment, and so on. So we will have some very on that. For example, Anka Thoma from the European Patient Forum, and so on. So it's going to be very interesting hearing all these different people on the base.
Fantastic, absolutely. And this is interesting because we are trying to build trust in health data, right, Deepak? So on that sense, how important is it to have a multiple stakeholder event like the one we are going to have in Ghent in the upcoming weeks?
Well, I would put it slightly different, Paul. I think it's impossible to talk about this topic without having all of the stakeholders present. So we're looking at trust from a few different perspectives. The one that everybody will be thinking about is trust as in data protection, using the data ethically and wisely, and making sure that we don't do inappropriate things with data, either that harm individuals or harm society. And yes, that is important, and we will be looking at that for sure with some very good experts in both plenary sessions and in breakout tracks. In the breakout tracks, the benefit is slightly smaller audience. There's a chance for audience interaction, panel discussion. The audience get a bit more involved in the topic, which is very interesting. But the other side of trust is about reliability. In other words, are the inferences being made from data scientifically valid? And that includes topics like interoperability. How are we ensuring that the data is accurately and safely transferred between systems? The quality of the data is an absolutely massive topic, because making inferences from poor quality data is not only a bit misleading, it can be dangerous. You're almost better off not knowing information points rather than knowing the wrong ones. But Jens, this really is your strong suit, and I feel that talking about data quality and telling the audience, or not the audience, but the potential audience, the people listening to this, what is going to be how does data quality fit in this program?
That's going to be awesome. And I think that
yeah.
Jens, you want to complement something?
Sorry.
Do you want to complement something?
Yeah, sorry. Yeah. Excuse me. It's really, but no, indeed, data quality will be implemented very strongly into the program. We will will have a track going through where we will address the on last year in Porto. We wrote a declaration on health data quality in Porto after our conference there. And some of these points which were very important when talking about data quality, we will use those, and we have some sessions. For example, what about education for data quality? It seems very important that all the stakeholders and ecosystem need to have a lot of education, awareness on data quality. So we will have a session on main topics when we want to engage stakeholders. How are we going to do this, and so on. But also we have sessions where we will address quality specific to certain stakeholder groups, for example, hospitals, and then specific to the management level in hospitals. Aware of data quality, this impact if you are handling or if you are reusing data, and so on. Stakeholders are a very important stakeholder group because they will data, so they are very important stakeholders, and they will have a session specific on data quality. What are they doing to ensure and to maintain the quality of the data they are using, or maybe are going to reuse? So throughout the conference, we'll have several sessions, but some sessions will emphasize data quality more specific. And of course, if you want to know which sessions I'm mentioning, please know who is going to speak in these sessions.
Thank you, Jens. Before we go into talk a little bit about the partners involved in this event, let me also stress here, obviously, the importance of hospitals as a key primary stakeholder. That they are health data producers in a certain way, getting the data from patients and then transforming those data and then making this data available for second use research. But then this draws also the question that who owns data, and what about the patient perspective on data ownership? And I would like to hear from Deepak on this subject, because I know there's a strong stream on putting the patients in the driver's seat in this specific conference, right, Deepak?
There is a strong stream on that. The topic of decision-making around data, ownership of data, is a complicated one because data ownership is itself a misleading concept in the law. So the important thing for us to be considering is not who owns the data, but who are the decision makers about the data. And that we will most definitely be discussing, partially about what might be the rights of patients over their data, what might be the ways in which patients get in some way recognized for the value their data brings. These will be hot topics we debate. Probably some of these topics will be quite heated discussions, I expect. So I look forward to discovering strong views being aired and maybe differing views being aired on these topics. But also, if I could, the topic of health equity is important. So it's one thing to talk about patients as individuals. It's another thing to talk about patients as members of society. And here we have a different issue, which is almost an obligation on people that their data should be used so that the learning we make from data properly reflects the diversity of society. What we don't want to find is that things like AI algorithms are developed using data from certain populations of society and don't work well, don't work safely in other populations of society. And that will happen if we don't look after that kind of, I won't say obligation, but there is a moral imperative on society to contribute data in ways that they trust, so that their type of patient counts in the learning that we have and the solutions we create. And we will be looking specifically at AI, because AI is really a hot and contentious area about data bias and characterization of people. So we really want to examine, and again, Jens has been instrumental in that topic in the agenda, to really examine how do we measure the bias that might be in data? How do we mitigate against potential biases that lead to algorithms that mislead? And we need to be careful about that.
Absolutely, absolutely, and this is awesome because what I appreciate the most in this partnership with the IHD is that you folks, you really have this almost Smith way to create an event, right? An event with a clear purpose, and this was the fact that already happened in Porto last year, where they had the LTATE quality declaration, and now we're going to take that as well, give another step forward. It's really awesome. And about this event is not happening alone. There's strong partnerships involved here. There's also Ghent, City of Ghent involved. So what could we expand on that area in terms of partnerships? Maybe Jens, you want to take the floor here?
Sorry, Paul, can you repeat the question? The internet was jammering again, sorry.
Oh, yeah, I was talking about the involvement of other partners that are going to make this event a true success.
Oh. Yeah, so first we have the City of Ghent, because this year with the conference, of course, what the first objective is to provide a high quality content, speakers, so that all the participants go home with keynotes, not keynotes, with takeaway and with new valuable content. But the City of Ghent as a partner is also contributing. I'm living in Ghent. It's a very beautiful city. It's a historic city. And I think it's also an opportunity for the people coming to Ghent to also visit it. It's a very nice, especially this time of year, it's a very nice, very beautiful city. So, and the City of Ghent is really helping us, providing all the touristic availabilities and helping us providing these training partners. So, for example, I have Metvia and also other strategic partners who are going to help promoting our conference, but also who are stakeholders, help us address the content we are going to give and trying to address this specific to those stakeholders group and trying to bring them also to having this some key points, some conclusions. So we have a lot of very interesting partners who are really helping us in promoting, but also in making only better compared to
Amazing, Jens. And this is really a reason why you shouldn't miss to attend physically, but also I also know that anyone who cannot attend physically can also join us online. Deepak, can you expand on that option?
Yes, well, we recognize that not everybody's able to make it physically. That's just normal. But we also understand that for some organizations, they are still quite cautious about investing in travel budgets. So I know some people, for example, who would love to be there in person, but they don't have organizational sign-off for their travel budgets. We recognize that post-COVID, a number of companies, for example, are having to recoup budget losses that they made. So we are sympathetic to that. So there will be the ability to capture the learning and the experience of being in the conference remotely. So that's available. But I will say, though, if you don't mind me pushing it, we find that the multi-stakeholder chemistry that really happens is an in-person experience. That, you know, patients speak to people in pharma, speak to people in medtech, or other way around. These things happen partly in the panel sessions, and it's difficult. We won't find it easy for panel questions to come from remote, because we will have such a vibrant audience. The questions will all really come from the room participants, probably. So if you want to be part of the interaction, part of the experience, part of the networking, you've got to be there. I'm afraid a lot of the magic is an in-person experience.
Definitely. And
Paul, you know this. I mean, I know you do both kinds of event yourself, and we're delighted, of course, to be partnering with you for our events. Like in Porto last year, where we had such a fantastic time with you co-organizing that event. And again, we're delighted to be with you on this event. But you know as well as I do that that the energy in the room is always electric, especially as you pointed out, that we deliberately do not have a bunch of random presentations in the session. Each session is carefully thought about in advance. What is the problem area in health data landscape that this topic should address? Who are the speakers that could really help explore it from different points of view, so people get a bit of a 360 view of that problem? And then how can we channel a panel discussion to really chew over the knotty problems that we don't yet know how to solve? And I think that's an experience rather than just something you watch on a recording.
Absolutely, Deepak. And may I add to that if you are still undecided whether to go or not go, obviously there's the option to watch online. It's not the same as going physically. And there's another added value for you to attend physically. I'm not sure there's still some spaces available, but there's the pre-tutorial, the pre-event tutorial on the 28th November. It's a massive masterclass full of content that you will benefit extremely if you are involved in this sector, in the healthcare sector, digital health sector, especially health data. You are going to learn a lot from the expertise of our tutors in the pre-conference event. Maybe, Jens, you can expand on the program for the pre-conference. First of all, are still places available for the pre-conference tutorial? You are muted, Jens.
Yeah, so for the pre-conference tutorial, we still have some places, but it's going very fast the last days and enrollments. So it's nearly almost full, which is good, of course. Just to note, it's not a hybrid pre-conference tutorial, so you cannot follow it online. So a reason more to join in Ghent. And it's the same like last year. It's also about data quality, specific data quality. Last year we had very nice talks about very important and very high valuable people dealing with data quality. And now we will turn more to hospitals. So we have around 5-6 hospitals coming to present a use case on data quality. Some use cases we did together. We tried to perform a project in which we define data quality objects and so on. But other hospitals will share and present their own data quality objectives or data quality projects, which they did on their own. So it's going to be a very are dealing with data quality, and we are receiving some presentations, some results already. We need to shape them a little bit into a presentation, of course, but it's going to be very looking forward to the last because that's something from the statistical unit here at the university, and she will give a presentation on the implications of missing data in your data set. Want to reuse that data? What are the implications on and what are the implications on management decisions? Her own data set, which is a fictitious data set, but she will try to show what are the implications of missing data, what's the financial problem, what happens with patient, which I'm looking forward to seeing. And it will be a very important awareness factor showing how important data quality is.
Absolutely. And in order to conclude here, because we are about to close the session now, this is a 30 minutes preview of the Joint Global Hybrid Summit and annual conference of the IHD in the 29th and 1st December, and with the pre-conference tutorial on the 28th of November. So I will put in a few minutes the website where you can still register and save your spot even for the online participation. But before we go, Deepak and Jens, just following what Jens just said, what will be your favorite presentations that you would like to highlight in the program for this year?
Oh my goodness. I couldn't possibly do that, Paul. That's the unfair question. I mean,
I know that.
I can honestly tell you that as we have been looking at each session, thinking about each speaker, planning the discussions we're going to have, the panel discussions, everything is exciting. You know, my problem is the opposite to what you say. Apart from the plenary sessions, there are 3 parallel tracks. And in some times, I'm not presenting in any of those tracks. And I'm going to say to myself, I've got to choose one. How do I choose? It's almost impossible. They're all great. So sorry, Paul, I'm not answering your question.
Okay.
Like any good politician, I say.
I know that this was a tricky question for you, Deepak, and I apologize if I put you on the spot here.
Don't worry.
But I am sure that there will be plenty of reasons for everyone to join us physically. And if you're not able to attend and to accommodate your travel budget to be at Ghent, then stay tuned, as you will be able to see at least the keynotes online. So without further ado, I think we have to say goodbye to our viewers, and thank you so much, Deepak and Jens, for taking a little bit of time for your busy schedules to be here with our dear viewers. And let's hope that we see each other again soon in Ghent.
Look forward to it, Paul. Wonderful.
And bye for now.
Thank you.
Bye, everybody.
Bye-bye. Thanks.